Look, first, we're going to kick off with can Keir Starmer make the NHS better? 0207 862 2222 is the number that you need to get your calls in right now. The Prime Minister has decided to abolish NHS England. That is the organisation which was set up in 2013 to handle the day-to-day running of the health service. He says that he'll bring management back to democratic control instead. And Health Secretary Wes Streeting says that around half of the 15,300 jobs at the organisation will have to be cut. But we haven't been told much about what the NHS will look like in this new world after the cutbacks are done. Kevin, NHS England was, I think, was the world's biggest quango, quasi whatever the acronym was. But essentially, a tax-funded body that was making decisions independent of the government. Gone. Is that a good idea?
I think it is organisationally. It's a good idea. You'll save a little bit of money, but I think it's about the statement and how you run the NHS in England. Wales, Scotland, Northern Ireland have different systems. It was set up in the early days of the Conservative Liberal Democrat coalition government to push the NHS away from the government, and in part, so ministers weren't as accountable, and it could start privatisation. More privatisation of services. I think it's failed. It's not going to solve everything, but I think it's a good idea. And it's a statement of intent by the Health Secretary Wes Streeting and the Prime Minister Keir Starmer that they are in control. They have to deliver. It's a political gamble by them because they can't blame other people. It's come back to them, and I think that is good. What you want as a patient is you want to be able to get treated quick, see a doctor, get treated quickly and be better. That's what you want.
Well, of course, that's what it has to do. It remains to be seen whether that is going to lead, what they've done is going to lead to that desirable outcome. And do we need to commend Labour for at least saying, look, we're not going to leave it to some organisation, a quango. We're going to take responsibility. It's going to fall on us. It's going to be political decisions. What happens to the NHS?
Well, I would commend them for a different reason. I mean, I would commend them for just simply getting rid of a huge layer of bureaucracy, which hasn't delivered. And in fact, the other parties are broadly supportive. I mean, there'll be a lot of question about the detail, but if you actually look at the response, the other parties are broadly supportive to what is going on. So I think that much is right. But you ask a bigger question. You asked, can Starmer make the NHS better? And I would say not without some extremely radical surgery. I mean, the fact is we've had governments tinkering now with the NHS for a very long time because it's a 1940s system trying to deal with, 21st century demand. And nobody foresaw, and nobody could have foreseen in the 40s, it's not a criticism, nobody could have foreseen then the sheer explosion of medical and surgical science, which was going to send demand soaring towards infinity. I mean, Bevan seriously thought demand would decline as we all got better. So we've got a situation we weren't expecting, and the situation is this. This is the question. And I asked for this question to be debated in 1998 when I was Shadow Health Secretary. And what we should be asking is this. If we were designing a system now of public health where, getting your health didn't depend on your income, if we were devising that system now, knowing what we know now and didn't know then, what would we do? And when you decide, out of several possibilities, presumably what you do, how on earth do we get there from here? And if we'd started that in 1998, it might be a lot further forward.
Okay. I'd still, if we started then, I would still want a system that is free at the point of use.
I said very clearly that it doesn't depend on what you earn.
When you are ill, you get treatment, just like you can go to school. So it's not linked to how much you earn, or you have to take out private insurance for the alternatives. Lots of T&Cs will apply.
But I want to go to callers in just a second, but do you agree with the basic principle that Anne's making, that if you were to design a public health service today, starting from scratch, the chances are it would look nothing like the NHS?
No, it would look like the NHS. You'd probably, in some ways, organise it better and cut out crinkles because you're starting again. But I think the fact that medical science is leaping and people's lives are saved now when they would have died in the past is a great success. That's going to cost, but I think it's a cost worth paying because we're saving lives.
Okay. I'm going to pause you there because I want to speak to people at home. Brian has got in touch from Newport. Good morning, Brian. What do you think? Can Keir Starmer make the NHS better?
No, because you've gone all the wrong way around. You could throw money at it, you can put new nurses, new doctors, but unless you get people out of the bed and social care sorted, you are not going to free up spaces in the hospitals, so it's going to be a waste of time. You know, how do you've got 20 surgeons but no beds. They can't do nothing. You've got 50 nurses. You can't. The ambulances are waiting outside. Why? Because there's no beds.
Yeah.
And it all goes to social care. You cannot do it without that.
Brian, thank you for that. And the Liberal Democrats that's been their response, what Brian said, that unless you deal with social care, you're always going to be tinkering with the NHS because social care is a bigger problem.
Social care is a bigger problem, certainly in the longer term with the rise in longevity. It's a bigger problem. Successive governments have failed to come up with an answer.
Why?
Because
why is it so difficult to solve social care?
It's very difficult. I mean, I know that I was looking at this in the early 90s when I was in what was then called the Department of Social Security, and we were in charge of social care. And we were looking at it then, looking at insurance systems, looking at shared insurance systems with the state, looking at all sorts of things, and every single one fell down.
It's because it's going to cost. And how do we pay that cost?
How do we pay it?
But ultimately, the point that Brian is making is that all the money that you're pouring into the NHS is, in a sense, wasted.
No, it's not all. No, it's not all. Brian got that. He was onto something, and then he went too big on it. Now, there are the so-called bed blockers, and you always get the numbers, but the cost, social care will cost. We either pay it individually or we pay it collectively.
Okay.
Or you get families to do rather more.
Well, that would be part of the individual cost, yes.
OK, let's hear a little bit more from people at home. Brian, thank you. Great call to get us started. Ian's in Blackpool. Good morning, Ian. Do you think Keir Starmer can make the NHS better?
Yes, I do think he can make it better.
How?
Ian Wes Streeting. Well, it's the amount of wastage that currently goes on within the NHS. I mean, I don't know if you're aware, but paracetamol, when it's dished out in the hospital, is 1,600% higher than if you were to buy it in the corner shop or downstairs in the chemist. And it's roughly made anything between 70 and 100 million pounds per year from 2016 onwards. So we're spending nearly 100 million pounds on paracetamol and other things like aspirin. Now, I think that, as Brian says, I think that if that money, if that savings of money were diverted into, and I remember the days, and maybe you do as well, Alexis, the days of the cottage hospitals, whereby, you know, the beds could be freed up and those effective bed blockers could be moved into local cottage hospitals, and the problems of the waiting times in the corridors could be probably solved, or at least aided.
OK. Ian, thank you. I mean, the wastage, I'm not quite sure I can't fact check the amount that they're paying for paracetamol, but certainly there has been wastage. Let's take another quick call from Philip in Wiltshire. Philip, good morning. Philip, do you think Keir Starmer can make the NHS better, or is he taking a step, perhaps, towards making the NHS better?
I think this is Keir Starmer doing one of his wonderful sound bites.
Right.
I've been working since 1966 until 1968 when I retired. 2018 when I retired, and for a period of time I was an accountant in a hospital. But my concern here is we're talking about thousands of people being made unemployed, basically. In all my years of working, I've never heard the unions so quiet over a number of less than this magnitude being put on the scrap heap. So I don't think that's going to happen. I think there's a deal behind the doors where these people will be moved into other things.
Right.
In 1992, when
I should tell you, Philip, that the
National
Unite Union
Trust-
has already criticised this decision because of the jobs that are going to go. But Philip, just a last point.
That hasn't
Keir
been on the TV
Starmer has
this
been
morning.
saying that if you always stop making big changes like that because people are going to lose their jobs and you have to restructure, then you'd never make any changes.
Exactly.
Oh, I agree. However, in 1992, I worked for a hospital, a large hospital, when it was going National Trust or NHS Trust or whatever the phrase was they used.
NHS Trust,
I can't
yeah.
remember. Yeah, and up until that time, hospitals worked on an accounting, receipts and payments basis. To do an NHS trust, when there was to then be able to go to the money market on their own basis, they needed corporate accounts. Nobody knew how to do them, so the ministry at that time sent accountants from 8 different hospitals in my Wiltshire area for 6 weeks to Regent's Park
Okay.
to learn how to be accountants. I'm sorry, I studied for 5 years. You can't do it in 6 weeks.
Okay, Philip, I think I get to where you're going. I've got to wrap it up because I've got to go to the break. But changing the way things were done and bringing accountants from outside, something that's come up many times. Thank you for bringing it up as well. Look, after the break, we're going to be taking more of your calls on this. More of your calls on whether Keir Starmer can make the NHS better. If you've ever worked for the NHS, I'd love to hear from you. And in fact, I think Bernadette from Merseyside. Good morning, Bernadette. You work for the NHS.
Good morning, Pam. Yes, I'm a retired female porter. I worked at the Royal Liverpool University Hospital, darling, and I saw the waste firsthand. Money's been thrown at the NHS time and time again. What Keir needs to do is look into the ambulance service.
Right.
We're not far from the town centre, so ambulances were sent out continually to collect drunken members of the public or people who'd been taking drugs. If they collapse on the floor, the police can't pick them up.
Yeah.
So they were taken up to being abusive in A&E, and we were top heavy with admin. I think we still are. We need to look into that. And again, tourists coming over, which was really frustrating, receiving free treatment. We couldn't go abroad and expect free treatment.
Well, if you went abroad, Bernadette, and you had an accident, you would get
yeah, but we have to take out insurance, darling.
Well, you have your free, but if you're in the EU, still applies. You're free. I think it's called an EHIC card still,
yeah, I've
European
got one.
Health Insurance
I've got
card.
an EHIC, yeah.
So that still applies. But Bernadette, thank you. Make good points there. Maggie is in Suffolk. Maggie, good morning. You're also working in the NHS, I believe.
Hi, no, actually, I'm a retired practice nurse. I
Used to work at the
20 years
NHS.
in
Thank you. So what do you think? Do you think Keir Starmer has taken the first step to try to making the NHS better?
Yes, I do. I think it is a really good move. It is very top-heavy, NHS England, lots of bureaucracy. My only fear with it is that he's only possibly be in government for 4 years. And this is a radical step. Mm-hmm. And if another government comes in and decides they don't like it, they'll start changing. And the NHS has gone through lots of. I've been in NHS for 48 years,
right?
And so many changes, and nothing gets to fruition because another government comes in and throws in something else. And I think that's just the only worry I've got.
Maggie, if before we go, if I gave you a magic wand, here it is, and you could change one thing in the NHS, which you, with your 40 years of experience, know that it would make a big difference, what would it be?
It would be to treat the staff better and to stop the public overusing the NHS, A&E, and get the GP practices working more efficiently.
Maggie, thank you. Let's move on to Angela, who's got in touch with us from Cardiff. Angela, good morning. Do you think Keir Starmer can make the NHS better?
Good morning. Yes, I believe we should give him a chance. I joined the NHS in the mid-70s, so I've been through all the changes and reorganisations that there have been. And I feel we should be looking at social care end of the funding. This isn't going to be popular, what I'm going to say, but we have told our children that not to expect any inheritance from us, that if we need to sell the house to be looked after, so be it. Inheritance isn't a right, it's a luxury. And having been a nurse for all those years, I feel if I need looking after, I want to be looked after well. And I just think there's this expectation that the government, councils, etc., will pick up all the bills. We all get more out of the NHS than ever we put in. And I just think that this is something that if we can do, that we should. But as a nurse and looking back at all these various changes that have been over the years, I do think we should give Starmer a chance. In some people's eyes, it can't get any worse.
Yeah.
So it has to get better. But here in Wales, and I know that one of the Tories' games during the election campaign was bashing the NHS in Wales. We've had experience of it 4 times in the last month with my husband's health.
Right.
And I have to say, we couldn't have had better if we'd paid. It's been extraordinarily good.
OK, Angela, thank you for your call. Let's quickly squeeze in Tony from York. Tony, we've only got just under a minute. What would you like to say, Tony?
Hi, yeah. I'm a registered midwife and I've been a midwife over 20 years. And I completely, 100% agree with Starmer's decision. I think it's the best thing he's done since coming into power last year. We often see staff, we're not providing effective and safe maternity care to women and babies because we have got a lack of midwives and we've got a lack of obstetric doctors. And you see managers in their offices having meetings about meetings. And when you ask them for help, they say they're too busy. So I completely 100% agree with what he's done. I think it's the best thing he's done since coming into power. So because we need more midwives, we need to be able to provide safe and effective care to mums and babies.
OK, Tony, thank you. Thank you all for your calls on this. Really nicely done. It's great to hear from so many people who've been working in the NHS.